The IMG Roadmap is the only podcast dedicated to coaching international medical graduates and success blueprints for this unique pathway. I am Dr. Nina Loom, your host, a previous IMG turned hospital medicine physician, healthcare administrator, speaker, and coach. I empower, encourage, and equip you with actionable steps that you can take towards the residency position of your dreams. This episode is sponsored by the IMG Roadmap e-course. The IMG Roadmap e-course is a step-by-step program that is geared to guiding international medical graduates on how to go from simple IMG to becoming a U.S. resident physician. You can check us out at imgroadmap.com. Welcome to the IMG Roadmap podcast. Tonight on the show, I have Dr. Stanley Ogu. He is a plastic surgeon out of Texas. But before further ado, guys, we all know in medicine, there's certain specialties that are just so difficult to get into. And that's even for U.S. grads, even for people that attend medical school here. But we have today on the show a physician that I met on Instagram just very recently, and I was so moved by his story. But before further, I want him to just go ahead and tell us about himself. Dr. Stan, welcome to the show.
Thank you, Dr. Nina. So I'm going to introduce myself. Just like you said, my name is Dr. Stanley Ogu, originally from Nigeria. I am a plastic surgeon based in Houston, Texas. I came to America after my medical school in Nigeria in 2008. And I initially did a general surgery residency, eventually transitioned to a plastic surgery fellowship, and I finished my training in 2018. I've been practicing as a plastic surgeon in the Houston area of Texas since then.
Amazing. I'm so inspired just reading about you on the internet and looking at the work that you do with the stories that you share through social media. It looks like if I need a body makeover, I know where to go. So just some additional questions regarding some of the things that you mentioned. So you mentioned moving here in 2008. Can you tell us where you went to medical school in Nigeria? Maybe what part of Nigeria that you're from?
Yes, so I was born and I grew up in the largest city in Nigeria, one of the largest in Africa, Lagos, Nigeria. So I did all my medical school training at the University of Lagos, Nigeria, one of the foremost medical institutions in Nigeria. The full name is the College of Medicine, the University of Lagos. So I spent about 6 years there, which is the length of time medical school takes in Nigeria. And after that, I moved on in 2008 after graduation.
Okay. Did you take your boards in Nigeria or did you do them here in the States?
So I started studying for and took the first step before I moved to the United States. I started reading for it in the final year of medical school. And then actually at the time, I don't know if it's the same, probably is, you could not take the usmles in Nigeria. I had to travel to Ghana, a neighboring country, to take the step one. And after taking the step one, then I finished up my training, and then I moved down here and took the rest of the steps in America.
Awesome. Because we know, a lot of IMGs that reach out to me that have aspirations in the surgical disciplines, they're always usually a lot more, in my opinion, scared compared to those that reach out with questions regarding medical disciplines. And by inference, we all know that some surgical specialties have higher score requirements. Can you walk us through sort of target scores for, because you did mention that you participated in a general surgery rotation or residency prior to matching into plastics. Can you walk us through step one performance, how important that is, and what target scores we should be looking at for general surgery? And then in addition, if you want to share your score, we definitely appreciate that as well.
Yes. So I think the step one score is the most important criteria. And I know this is not just based on my experience, but also I've been involved while I was in training as a chief resident a couple of times with the selection process and how the interviewers think and how they view these applicants. And especially if you're an IMG, your step one score is critical. It's what might get you a foot in the door to even get an interview, or what might cause them not to even look at your application. Specifically talking about the surgical residencies, I would suggest that you aim for a step one score above 240. My step one score, geez, I'm trying to remember, it was probably 249 or 250. I don't remember exactly. But, and what I've noticed is that since I did my exam about 10 years ago up to now, and looking at the quality of the applicants and the candidates, it's gotten a lot more competitive. So at the time, my score was great, phenomenal, but this time it'd probably be average for anyone applying to the surgical specialties or plastic surgery. And so it's gotten a lot more competitive. So I'll definitely say, again, aim for scores above 240. Just aim as high as possible, but certainly above 240, especially for step one. I would say the same for the step two, but the step one is the more critical score that you should want to score as high as possible.
Right. And do you remember, and I feel like I also took step one many years ago. I think I did it in 2008 or 2009. I can't remember. But, I think the test has changed a lot since then. And back then, the resources that we used were very different from what's on the market now. Are there particular resources that you recommend from your experience or from maybe working with or teaching medical students while you were in training? Are there particular resources that help more than others?
Yeah, so I'll talk about what I used, but with a caveat that was 10 years ago, because even the materials I used at the time have sort of changed a little bit in their focus. There's new things to study and new findings, and so some of it has changed. But in general, I think it's remained similar to what I used. And at the time, what I did was I had what they call Kaplan notes, which I think still exist. I also had the first aid for the USMLE. And I did a lot of questions from USMLE World, which is a question bank, which at the time was very effective. I have been out of academia for a couple of years now. I was in it during my training, and so I mentored a lot of students, and I kind of followed their progress. And I know that at the time they were still using the first aid and the USMLE World. I don't know about the Kaplan notes if that's what's currently sort of like the top notch recommended study material, but that was what I used about 10 years ago.
So just another question that I get a lot, did you have any gaps between, considering that you graduated from your 6-year curriculum in Nigeria before moving to the States, did you have any gaps between, graduation, actually beginning your first general surgery residency program, and how did that affect, the outcome, so to speak, if you did have any?
Yes, I did have a gap. And I think this is something that a lot of IMGs coming into the United States do not really appreciate until they get here. Like I said, I'd taken the first step during my final year of medical school. And my plan was to finish and then come over here and take the rest. However, you got to remember that when you're done taking the test and you've got to apply, the application cycle starts in 1 year and ends in a different year. And then if you match, then you start residency in that second year. So if you haven't taken all your steps by the time you come to the States, you're definitely going to have at least a year gap. So in my case, I had a gap from early 2008 when I moved down till I started a residency in 2009, in mid-2009. So at the time I was working, I was tutoring students for Princeton Review and Kaplan, doing all the things I could to keep myself busy. But I did have that gap. Now, it never came up during my interviews as an issue. I guess if the gap wasn't that significant, or if you were obviously applying yourself, doing things. I was also doing observerships at the time. And so I think it wasn't a major issue. Again, having been part of the selection process, I do know that large gaps are an issue. And if you have graduated many, many years prior to the year that you're applying, that is also an issue, something that is frowned upon. But I think a gap of a year or so for an IMG is typically not a huge deal.
Right. And what I'm really hearing from what you shared is, even while you were during the time of that 1 year gap, you were actively involved in sort of academic activities because you were participating in observerships. You were tutor for Kaplan and Princeton Review. So in a sense, you weren't just sitting around like twiddling your thumbs. I think that also plays a big role because I get a lot of messages from IMGs who maybe have taken 5 years off to be homemakers or, 6 years off, and they're really not doing anything academically relevant. And that also, in my opinion, more as a prior person that was a chief resident in a medicine program, I'm looking at it more so as that's also being frowned upon. So it's important to keep an academically relevant activity, whether that's research or an observership or being clinically relevant during that time. Would you agree?
Yeah, absolutely correct. I've had some colleagues and also some other IMGs who have mentored who, also had a bit of a gap. I'm talking 2, 3, 4 years, but within that time frame, they were either doing a master's and concomitantly doing some research, or they were still involved in the medicine space. And so they were making contacts, meeting mentors, getting letters of recommendation. So by the time they were ready to apply, it didn't seem like they had really been away from medicine. Because I think it's that the gap, when that gap is filled with nothing clinically significant, that's when, it's a major problem. Or if it's a very long gap, regardless of what you're doing, if the gap is very long, they feel like, that's an issue. That's something that affects your application negatively.
Right. Thank you for touching on that point. So just another question. Do you mind telling us maybe where you graduated general surgery residency and where you did your plastic surgery training?
Yes, absolutely. So I did my general surgery residency in Pennsylvania, Eastern Hospital, Pennsylvania, with Drexel College of Medicine. And I did my plastic surgery at Indiana University in Indianapolis, Indiana.
Okay. And so because this is not very common for us, especially those of us that are listening on here, I would like for you to just walk us through how plastic surgery as a specialty, because in my assumption, there is a categorical pathway. Like you could start from, being a plastic surgeon from PGY1, but then it sounds like you did more of a general surgery residency and then a plastic surgery fellowship. Can you talk to us about the time frames, how long that process ended up, lasting, and maybe
Yes.
in comparison to going in straight into plastic surgery from the get-go?
Yes, yeah. So just to clarify something you touched on, there are 2 different pathways to get into plastic surgery training. The first one, which you get into directly after medical school, is called the integrated pathway. For the integrated pathway, it's 6 years plastic surgery training, and then after that, you can decide to do a year fellowship or whatever you want to do. By the end of 6 years, you're a plastic surgeon. For the independent pathway, which is the path that I took, you finish a prior residency, you graduate from that, and prior to your graduation, you apply to match into a plastic surgery fellowship, and that takes an additional 3 years of training. And at the end of those 3 years, you are also a plastic surgeon. So as you can see, the integrated pathway is obviously the shorter pathway to around 6 years. For the independent, it could last anywhere from 8 to 9 years, depending on what prior residency you did. I've seen people who match into the independent pathway from general surgery like myself, and it depends on how many years the general surgery program is. It could be 5 or 6 years. I've seen people who match from other subspecialties such as ENT as well. And so the integrated pathway is a more competitive pathway because you're competing with, typically, again, this is from what I've seen as being part of the process, some of the brightest minds from American medical schools with some of the highest scores, step 1, step 2, and everything. And then you as an IMG are trying to compete with these people who are essentially seen as better candidates than you. So that's sort of like a tougher route to take. I haven't seen a lot of IMGs match into the integrated pathway. Most of the IMGs who I've seen matching into plastic surgery, they went through the independent pathway like myself, which is still pretty competitive, but I would say it's the easier way to get in, because once you're in any residency here in the United States, you kind of level the playing field a little bit once you got your foot in the door. And so those are the differences between both pathways.
Thank you so much for breaking that down. Being a non-surgeon, that's also a learning point for me as well. But I do believe that that's something that we should just speak on a little bit, because I have, I'll hear from some IMGs who want to pursue certain very specific subspecialties, but they don't realize that you can achieve that through several different routes. It's not common always, but there's a method around it. So for example, like you just walked us through how to match into plastic surgery even without matching into an integrated pathway, which would be right after medical school, but still ending up with, board certification that allows you to practice in that specialty. To that same token, on the medicine side, there are several ways to, there's people that maybe want to match into GYN, and I'm just throwing this out there. You can always match into, or OB, I should say, you can always match into a primary care specialty, family medicine, and then do an OB fellowship. Like there's a way around it, and there's a way around doing family medicine and matching into an ER fellowship, or, doing internal medicine and later on matching into an ER fellowship. So there's ways around things that still allow you board certification. You just have to study that specialty and see what's approved. Preferably have a mentor in that specialty that can tell you these things, because it's really hard to find this information on the internet. Would you agree?
Yeah, I would agree. I think one of the important things is if you know what you want to do, start early on, start looking for information on that thing. Look for a mentor, look for someone who's been through the process, and they're usually the best sources of information, because if you're, like you said, looking on the internet, you're going to find a lot of things, and sometimes you don't find much. But if you can find someone who's been through that process, they can better guide you and sort of mentor you to achieving that goal. And these days with, the internet and social media and things like that, that's not very difficult to find. So I think that's the best way to approach it if you're interested in that specialty.
Right, I agree. So just some. Let's get a little bit personal here. How about that? So, I get a lot of IMGs when I listen to their stories, and as one myself, it almost seems as if sometimes when I share these stories, it looks so easy, right? Because they'll tell me, hey, Dr. Loom, it looks like you just had an easy way through. You haven't experienced any particular challenges, but I have more against me or working against me than you do. So what would you say from your experience? Was this a challenging process for you? Are there specifics that you want to share with us so that the person listening can really understand that this is not, we're not special having matched as IMGs in whatever specialties that we chose, but there is a way around it. There's a method. And what are some things that you've experienced, and maybe from your personal experience, give us some lessons learned?
Yes. So I think in my case, there are certain things that worked in my favor and certain things that, were not in my favor, not because, I was unlucky, but I just didn't know about them. So for the things that worked in my favor, I started early sort of dreaming about coming to the United States right from my very first year in medical school. That was always something I thought about. And so having that dream, I had always sort of planned towards it. And I was kind of in my head and applying what time I was going to take my steps, what I was going to do. And that led me, prior to finishing med school, to apply for and get accepted to do electives here in the United States. At that time, I didn't realize how important that was. And even though I didn't do an elective in the specialty that I matched in, because I was just kind of looking for any elective out there that I could take, but just the fact that I come into the United States and spend a couple of months just, understanding the medical system and just, doing a rotation, I think that was a big plus in my application. The other thing I would say worked in my favor, besides early planning and, doing the electives, was I was fortunate enough to move to the United States with a green card and not require a visa. I think that opened up more opportunities for me compared to people who needed different kind of visas. And so those things I would say were things that worked in my favor. For things that did not work in my favor was, I would say one is that I didn't realize the magnitude of sort of like handicap that you have as an IMG. So, when I was applying, I was applying to so many programs. Out of all the applications that I put in, I probably got a 10% response back. And so at some point I had to scramble and do some more applications because I was like, this is not looking good. But most IMGs, especially when you're applying to a surgical specialty, you have to understand that you're really operating from a severe handicap, because the way you're looked at is different from the way you look at an EMG. You should focus on targeting certain programs who have been more receptive to IMGs. And at the same time, you should think about casting a wide net and not just focus on, for example, university programs or programs in a certain, geographical area, because you don't know where you're going to get an interview from. and it's an expensive process. The more competitive the specialties, the more expensive it's likely going to be. And you should just be ready to have a good backup plan if it doesn't work out.
Right. Just some things to touch on, because I agree. You mentioned this previously. You did say that most IMGs, like, one thing you recommend is to focus on getting in first, and then once you are a resident, you can always investigate options for a second residency or a second fellowship. And then, you came back to it and really spoke to your drive and the thing that brought you here. So I think it's really important that we talk about that a little bit further. A lot of IMGs sometimes, we want it, but we don't want it that bad. I feel like that's harsh, but it's worth saying, because if you want something really bad, you'd be willing to take the longer route to get there. And sometimes we get so bogged down, especially, unfortunately, I get this a lot from some of the women that I speak with, is we get so bogged down by the time it's going to take and how long it's going to take. But here we are on this podcast today listening to Dr. Stan, who's telling us he took the longer route to get to being board certified in plastic surgery, but here we are. So just some final word of encouragement for people that are struggling with that idea of the time and the challenges and the competition. Do you have any word for those people?
Yeah, absolutely. So I would say, the most important thing, like I said, is having a plan and having a vision, having a dream. Once you have that, then you're going to try to do everything within your power to achieve that dream. And in my case, it was, right from, like I said, way back, I wanted to come here and I wanted to do plastic surgery. And I said, no matter what it takes, I'm going to get there. And I wasn't stuck with one plan that, I'm going to match, right away from medical school. I mean, I tried that, but at the same time, I had a good backup plan to get into general surgery. So having the drive, having the plan, having the vision is great, but also planning for eventualities that may happen, okay, is also as crucial. And then I wasn't deterred by the time. I said, how old am I? How long have I spent going to school? If it's going to take me another 6, 7, 8, 9 years to get to my destination, and that's what I want to do, then I'm going to stick with the plan as long as I'm moving in the right direction. And so you need that kind of drive. You cannot be bogged down by, this is day one, it's going to be another 6, 7, 8 years. No, you just have to just keep your focus on the goal and say, I know where I'm trying to go, and I'm going to get there, and I'm going to keep moving forward in the process. And that was the way it was for me. I would also say that I really enjoyed my time in training, and so that was kind of helpful. Surgery training is brutal, it's hard, it's tough, but because I was doing what I enjoyed doing, and I also had, the secondary, or I would say the primary goal, at the end of it, every day to me was just like, I'm having fun. I'm just going to keep moving forward.
Thank you so much for sharing that. Now, can you tell us a little bit about where you're at now? I see you doing all these great surgeries and helping women get themselves all snatched. Can you tell us a little bit about your current practice?
Absolutely. So I moved back to Houston, Texas, which was originally where I moved to when I moved from Nigeria before going out to train. I moved back to the Houston, Texas area last year, actually 2018, because this is 2020 now, so 2018. And I joined a multi-state practice. My location is the only one in Texas, and it's Lexington Plastic Surgeons. We're located in Sugar Land, Texas. If you go to my Instagram, Dr.Stan_plastics, I have all the information about the location and the range of surgeries that I do. I do about 80% cosmetic surgery of the face, body, and breast. I also do about 20% reconstructive surgery, which is centered mostly around keloids and wounds and wound care. And so I do everything pretty much. So going on to the Instagram page will give you a clear idea of most of what I do.
Wow. Thank you so much. I'll definitely put your information, your Instagram connection in the show notes. So anyone that's interested in following Dr. Stan's journey and learning more about what he does, we'll have all that information for you. Thank you so much for joining us on the IMG Roadmap podcast. It's been a wonderful pleasure to have you on here. Anything else you want to share with us before we let you go?
Oh, I just want to say, there's a lot of people out there who right now, all they see is just the forest. They can see the trees. I was once there. I was once like that. But because I knew I had a destination in mind, I had a focus, I was just able to just stick to the plan to keep moving forward. The residency process, getting in is tough. And once you get in, you think, oh, finally I've made it. And then you have to deal with the actual residency training itself, which in itself is a completely different story. But for most people, I just want to encourage them and say, if you're an IMG right now who's either in med school, you just graduated, you're dealing with the steps. I know what that feeling is like. I was once there, and you're thinking it's never going to end. But just stick to the plan, keep working hard, and it's going to happen for you.
That's a word. That's a word right there. We'll take that and run with it. Hey, I just thought of one more thing because this is another question that I get often. Research. Tell us about research and surgical specialties. There's the common knowledge out there that to match into a surgical specialty, one must participate in research. Did you do any research?
Yeah, so I did very little research as a medical student in Nigeria. And having, again, been part of the selection process, I know that research is important. It's not as important as just, USMLE scores, but it is important. It's something that we could use to value one candidate above another. And so while I didn't do any research, I would encourage any IMG out there who has the opportunity to do it, either as a medical student or while you're waiting for, the match or taking the exams, to actually partake in it and list it in your CV. One thing I found interesting was when we're looking at the different applicants and looking at their CV, sometimes the actual research is not important. They're just looking at how much research they've done, which I thought was odd because you could have someone with 20 case reports and it's listed as 20 research. You could have someone who, went through a whole clinical trial and it's just one paper published and then it's listed as one. So I found that quantity was actually more important than the quality of what you're doing. So get your hands into as many things as you can. You never know when it's going to come in handy. And also know what it is that you're putting on your CV as research that you did. You'd be surprised at how many people will try to talk to you about their research and they can't really talk to you about it. So that's just something when you do get the interview. But prior to that, just get as many as you can and just get out of that CV.
Right. And just because you mentioned being a part of that selection process, and I want to be as thorough as possible because we don't get a lot of plastic surgeons on the show. What are some other things that, you would consider make a complete, perfect portfolio for an IMG? So if you were looking at, back in the day when you were working in the chief resident role, when you were looking at applicants, right?
Yes.
What would have been the attraction factor to an IMG or for the program to be drawn to an IMG?
Yeah, so just looking at the candidate on paper prior to when they select for interview, the biggest thing that stands out, and I can't stress this enough, is the step 1 score. Now for the IMG, that's just one thing that makes you stand out amongst everyone else. Like the step 1 score is higher than everyone else, including the American graduates. Your application is probably going to get a second look. Now, having said that, the other things that I found that were important were the nature of the reference letters that you got and where they were coming from. And for a lot of IMGs, unfortunately, because they don't have that either elective experience or observership or whatever it is, so they don't have the opportunity to get really good letters from people who matter in the field of plastic surgery. But if you as an IMG have an opportunity to either observe or rotate with any faculty in plastic surgery, especially from a big institution, you need to jump at it and you need to distinguish yourself during that rotation and then ask the person to write you a letter. Because plastic surgery is a small world. It's a small community. We know almost everyone in the community who matters. And so it could just be the person's name on your letter. And that's all it takes to get you the interview. But again, the most important thing is the step 1 score. And then the second thing I would say would be your letter of references and the contacts or connections that you make.
So in addition to that, when I compare that with maybe medical specialties, one of the things that we do for medicine is you can go to a conference and meet programs and connect and network with them as a great way to introduce yourself and ask for opportunities to observe or shadow. Is that the same in the world of plastics, or is that too forward? What are your thoughts on that? What are some ways that people who have no connection, so people who don't have any person they know that's here that's a physician, how can they put themselves out there? Where do they go for that kind of a resource?
Yes. So what I would say is I can speak based on my experience. While I was in general surgery and I already knew I was going to apply to plastic surgery. So I started trying to attend the plastic surgery meetings while I was a general surgery resident. While I was doing that, I met a couple of people and, just chatted and said, oh, this is where I'm from. This is who I am. I'm really interested in plastic surgery. Do you mind if I came over to your institution to spend a month doing a rotation? So my residency gave us the opportunity in the fourth year, I believe, or was it in the third year, to go out and do a month of elective in whatever subspecialty you're interested in. And in my case, I went to University of Pittsburgh, where I met a couple of the faculties at the meeting, and I was able to do an elective there. And that opened a lot of opportunities for me, and I got, some good recommendations from that. So I can speak to it from that standpoint. But for someone who has no connections at all, or you don't know anyone in the field, you can't find someone to mentor you, then if you can get into the meeting and just meet somebody and talk to them, that would be, it's a shot in the dark, but it's worth it, I think.
Yeah, definitely. I think we will miss 100% of the shots that we don't take. I'm a firm believer in asking for what you want and putting yourself out there. You get no's, you get multiple no's, but you give it a try. I mean, I actually recommend for people, if you first move to the States, whatever state that the person is in, you can just start looking up, the renowned people that are popular in that specialty that you're interested in. All the information is usually on the internet. And you can send emails, you can call offices, and you just never know who'll give you a listening ear. Yes, there's going to be so many people that are going to say no, but if you don't try, you'll never really know. And it sounds like that's what I'm hearing from you. Like, be bold, be forthcoming. You're going to get lots of no's. You're going to get people who don't have time to listen to what you have to say, but you may get one person like myself or like Dr. Stan who understands the process and is willing to talk to you, and they can show you the way.
Absolutely. And that just reminded me of something that happened in my case. While I was applying for residency, like I said, I got probably a 10% response rate, which a lot of people said, oh, that's actually good for surgery, but I thought was abysmal. And so what I did was every program who I hadn't heard from, I picked up the phone and I called them, starting from the first to the last. And I got a couple more interviews just by doing that. There was one of them that said, oh, we sent you an interview. We didn't hear back from you. It turned out they sent it to the wrong person. So if I didn't call them, I wouldn't have known. There's another one that said, we just got a couple of cancellations. Are you going to be willing to come down and interview on this date? And I said, of course. I'm not doing anything. I'll be right there. And so that's part of, just keeping your focus on the goal and not giving up until the very end, and just doing whatever it takes to get to your goal or to your destination.
Right. Thank you so much. I feel like this podcast has been very insightful, just filled with so much wisdom. And I know anybody listening today probably is gaining a lot from our conversation. We should have stopped several minutes ago, but one more thing that I want to talk about. So back to the world of plastics and talking about how to prepare yourself for residency. Just to recap, just so if you just joined the podcast right now, here's what Dr. Stan has shared with us. Letters are important. It's a small world. It's a small niche, a specialty. Try to get rotations with people that can offer you strong letters. Scores are the most important thing for step one. We do recommend scoring way over the median or mean, which is currently about 240. So be over that. There's two pathways to this. You can do the integrated pathway, or what was the other pathway? Can you remind me again? The integrated or the
independent pathway.
Independent pathway. And that in either one of those could be, from Dr. Stan's experience, what he's telling us is, hey, you can match general surgery and seek out fellowship through your program and through networking, attending conferences and participating in local plastic surgery meetings. Research is strong, right? You did mention that research is considered strong. The amount of research is actually more important, in your opinion, than having one.
The quality.
Yeah. And that's odd. You would think that it would be, hey, if I had one randomized control trial, I'll be okay. The person with 10 case reports.
Right.
It's pretty. So any final words for us? I feel like you have so much wisdom. I don't want to miss out on anything.
Yeah. I feel like, you've covered a lot of the things. The only thing I would add is, for the independent pathway, because you already did a residency, like I said, it gives you sort of a better chance of matching into plastics. However, it's not a shoe-in, it's not a guarantee. You still have to do well during your residency training. Like in my case, I had to make sure that all the in-services we took, I kept my scores, as high as possible. Because I wanted to be able to distinguish myself when we're going out to the interviews. And so even if you have good USMLE scores and you're going through an independent pathway, you still have to maintain your academic brilliance to give yourself the best chance to match through the independent pathway as well.
Right. Wow. Very insightful. Dr. Stan, if I ever come to Houston, I'll definitely DM you, okay?
Yeah, absolutely. Anytime. Just let me know.
But thank you so much for coming on the podcast and sharing all this wisdom with us. Congratulations on all the success that you have achieved. You inspire us all as IMGs. One of the things that's so challenging for us, particularly I can speak for being for a West African, is when we look at other people just like us doing great things, it gives us the gusto to keep fighting. So thank you for coming on the show, and we hope you have a good night.
Absolutely. I wish you the same. And I also want to thank you for what you're doing. I know it might be a thankless, but also a selfless thing that you're doing. And I'm sure it's going to help a lot of people.
I hope so. This episode is sponsored by the IMG Roadmap e-course. The IMG Roadmap e-course is a step-by-step program that is geared to guiding international medical graduates on how to go from simple IMG to becoming a U.S. resident physician. You can check us out at imgroadmap.com.